Okay, today we are discussing about the nasal cavity. The nasal cavity extends from the anterior nares or nostrils. We call nostrils are also called as anterior nares. It extends from the anterior nares to the posterior nares here. So these are the posterior nares. Okay, so the nasal cavity extends from the anterior nares nostrils to the posterior nares. We call it these two are the posterior nares, and each nasal cavity has roof, floor, medial wall and lateral wall. Nasal cavity has roof. It is found by cribriform plate of the ethmoid. It is called, this is the roof. This is the roof which is formed by the cribriform plate of the ethmoid. You can see the roof here. So the roof it is formed by the cribriform plate of the ethmoid, and the roof slopes forwards and backwards. Here this is the roof of the nasal cavity. So each of the nasal cavity, it is having roof, floor, medial and lateral walls. So the nasal cavity consists of roof, floor and medial walls, and the medial septum divides the nasal cavity into equal two halves. This is the median nasal septum which divides the nasal cavity into two halves. So the coming to the roof of the nasal cavity, the roof of the nasal cavity, it slopes downwards and backwards. It slopes anteriorly and posteriorly, and the middle horizontal part of the roof, it is formed by the cribriform plate of the ethmoid. So we can see the cribriform plate of the ethmoid. So we can see the cribriform plate of the ethmoid here. This is the cribriform plate of the ethmoid which is pierced by more number of olfactory nerves. The cribriform plate of ethmoid is perforated which is pierced by olfactory nerves. So this is the cribriform plate of the ethmoid. This is the roof of the nasal cavity, which is the middle horizontal part is formed by the cribriform plate of the ethmoid, and the anterior slope of the roof, it is formed by the nasal bone. It is formed by the nasal bone and frontal process, and the nasal process of the frontal bone. This is the nasal process of the frontal bone, and this is the nasal bone, and it is also formed by cartilages. It is also formed by superior nasal cartilage as well as inferior nasal cartilage. So the anterior part of the roof, it is formed by the frontal nasal process of frontal bone and also nasal bone and also the cartilages, the superior nasal cartilage and inferior nasal cartilage. They form the anterior slope of the roof. And coming to the posterior slope of the roof, it is formed by the body of the sphenoid, inferior surface of the body of the sphenoid. We know that sphenoid, this is the sphenoid bone. See here, this is the sphenoid bone. Okay, this is the sphenoid bone. So this is the sphenoid bone. This is the lesser wing of sphenoid bone, and this is the lesser wing of sphenoid bone, and the remaining are the greater wing of the remaining part is the greater wing of sphenoid bone. So, and this is the center part is the body of the sphenoid bone. So the posterior slope of the roof, it is formed by posterior slope of the roof, it is formed by the body of the sphenoid. So the roof consists of, it slopes anteriorly and posteriorly. The roof, it slopes in front and behind, and the middle horizontal part is formed by the cribriform plate of the ethmoid. So this is the cribriform plate of the ethmoid. We can see the cribriform plate of the ethmoid. This is the depression, we call it as cribriform plate of the ethmoid, and we have a projection, we call it as crista galli. In medial to the cribriform plate of the ethmoid bones, we have a projection, we call it as crista galli. Okay, so the roof is formed by the cribriform plate of the ethmoid, and also it is formed by the nasal bone. So this is the nasal bone, and the frontal process of the nasal process of the this is the frontal bone, right? So this is the frontal bone, and it is also formed by the nasal process of the frontal bone, and also it is formed by the inferior nasal cartilage and superior nasal cartilage. So those form the roof. And coming to the floor, it is formed by the perpendicular plate of palatine bone. Floor, it is formed by the perpendicular plate. So this is the floor which is formed by the hard palate. So the perpendicular plate of palatine bone and also palatine processes of maxilla. Palatine processes of maxilla and perpendicular plate of palatine bone, they form the floor. And the roof, it is about 7 centimeters in long. Roof is about 7 centimeters long and 1 to 2 millimeters width, and the floor, it is about 5 centimeters long and 1.5 centimeters wide. So this is the roof of the nasal cavity, and this is the floor of the nasal cavity, right? So each nasal cavity consists of roof, floor, medial and lateral walls, and the nasal cavity, it is divided into two halves by median nasal septum. This is the medial nasal septum, which divides the nasal cavity into two halves, right and left halves by the medial nasal septum. And each roof of nasal cavity consists of roof, floor, medial and lateral walls. So the roof, it is formed by the cribriform plate of the ethmoid in the middle, and the posteriorly it is formed by the body of the sphenoid bone. So this is the body of the inferior surface of the body of the sphenoid bone. Here we call the sphenoidal air sinus here, and this is the frontal air sinus here. So and the anterior slope of the roof, it is formed by the nasal bone and the nasal process of the frontal bone, and also the septal cartilages, nothing but the superior nasal cartilages as well as the inferior nasal cartilages. They form the anterior slope of the roof, and the floor, it is about 5 centimeters long, and the width is about 1.5 centimeters wide, and it is formed by the hard palate, and it is formed by the palatine process of maxilla and the perpendicular plate of palatine bone. So this forms the floor of the nasal cavity. So this is the floor of the, because this is the nasal cavity, right? This is the nasal cavity. Okay, so the floor, it is formed by the perpendicular plate of palatine bone and also palatine process of maxilla. Okay, so that's about the roof and floor. And coming to the important one, that is the medial wall or the medial wall of nasal cavity, or we can otherwise call it as nasal septum or medial wall of nasal cavity. So this is the medial wall of nasal cavity. Medial wall. So the medial wall or nasal septum, which divides the nasal cavity into two halves, right and left half. Usually the nasal septum, it is not strictly median, it is divided, it is deflected to one or other side. It is the nasal septum, it is not strictly median, it is deflected to one or other side. And coming to the medial wall, or we call it as nasal septum. So the medial wall or nasal septum, it is formed by, it consists of bony part, cartilaginous part, and it consists of cuticular part. So the nasal septum or medial wall of the nose, it is consists of bony part, cartilaginous part and cuticular part. Okay, so coming to the bony part, the bony part of the nasal septum, it is formed by the vomer. So the bony part of the nasal septum, it is formed by the vomer. So we can see the vomer here. So look at here, this is the vomer. We can see vomer here. So here we can see the vomer here. This is the vomer. This is the vomer. This one. Okay, this is the vomer. So the medial part. So the bony part, it is formed by the vomer. This is the vomer, and also it is formed by the perpendicular plate of ethmoid. The bony part of the nasal septum, it is formed by vomer and perpendicular. This is the perpendicular plate of the ethmoid, and this is the vomer. So the bony part, it is formed by the vomer and the perpendicular plate of the ethmoid bone, and it is also receives contribution from the nasal crest of the nasal bone. Here is the nasal crest of the nasal bone, and also nasal crest of maxillary bone, and it also nasal crest of lacrimal and maxillary bones. It also receives contribution from the, not only from the nasal crest of nasal bone, it also receives contribution from the nasal crest of lacrimal as well as the maxillary bone. So the bony part of the nasal septum, it is formed by the vomer, right, vomer, and this is the perpendicular plate of ethmoid. I have labeled it here. This is the perpendicular plate of the ethmoid, and this is the vomer. Okay, and it is also receives contribution from the nasal crest of nasal, palatine as well as the maxillary bones. It also receives contribution from the nasal crest of nasal bone and the nasal crest of palatine bone, and also lacrimal bone, and also it receives contribution from the nasal crest of maxillary bone. So that's about the bony part. Bony part, mainly two bones, one is vomer and next one is perpendicular plate of the ethmoid. So this forms the bony part. And coming to the cartilaginous part of the medial wall or nasal septum, medial wall of nose, we can call it as nasal septum. It is formed by the septal cartilage here. So this is the cartilaginous part. Okay, this is septal cartilage, and also the septal process of inferior nasal cartilage. Septal process of inferior nasal cartilage and septal cartilage, they form the cartilaginous part of the nasal septum. So this forms the cartilaginous part of the nasal septum, and the cuticular part of the nasal septum, it is nothing but is covered by skin. It is fibrofatty tissue. It is covered by skin and consists of fibrofatty tissue. It is covered by skin, consists of fibrofatty tissue. This is the lower part of the nasal septum, and this the lower margin of the nasal septum, we call it as columella. The lower margin of the nasal septum, we call it as columella. Okay, so the nasal septum and medial wall of the nose consists of bony part, cartilaginous part and cuticular part. Okay, so the bony part, it is formed by the vomer and perpendicular plate of the ethmoid. This is the vomer bone and this is the perpendicular plate of the ethmoid. It also receives contributions from the nasal crest of maxillary as well as the nasal bone. It also receives contribution from the nasal crest of the nasal bone and as well as the maxillary bone. And this coming to the bony part, it is formed by vomer and perpendicular plate of the ethmoid. And coming to the cartilaginous part, it is formed by the septal cartilage and septal process of the, this is the septal process of the inferior cartilage and this is the septal cartilage. Okay, and the cuticular part, it is formed by the skin, which is covered by the, it is nothing but fibrofatty tissue which is covered by skin. Okay, and the lower margin of the, this is the lower margin, right? This is the lower margin of the medial wall. We call it as columella. So that's about the medial wall of the nose, or we call it as nasal septum. And one more thing is the nasal septum it is not strictly median. It is deflected to one or other side. It is not strictly median, it is deflected to this side or this side, mostly to the left side. Okay, so the nasal septum, it is not strictly median. So coming to the, and the nasal septum, it is divided into 4 quadrants. Okay, so the nasal septum, it is divided into 4 quadrants. Look here, this is the antero-superior quadrant and this is the antero-inferior quadrant. This is the postero-superior quadrant and this is the postero-inferior quadrant. So the nasal septum, it is divided into 4 quadrants: antero-superior, antero-inferior, postero-superior and postero-inferior. See here. Okay, so this is the medial wall of the nose, which is divided into 4 quadrants. 1, 2, 3, 4. 4 quadrants, right? So this is the antero-superior quadrant. Antero-superior quadrant, blood supply. Coming to the blood supply. Coming to the blood supply, the antero-superior quadrant, it is supplied by the anterior and posterior ethmoidal artery. So the antero-superior quadrant is supplied by the, this is the anterior ethmoidal artery and this is the posterior ethmoidal artery. So the antero-superior quadrant is supplied by the anterior and posterior ethmoidal arteries. And antero-inferior quadrant, this is the anterior-inferior quadrant, right? In the antero-inferior quadrant, it is supplied by the labial branch of facial artery. So the facial artery, it enters the face at the lower border of the angle of the mandible and it descends upwards up to the medial angle of the eye. It ascends up to the medial angle of the eye. Here it gives one branch that is called labial branch. Okay, so the labial branch supplies, superior labial branch supplies the antero-inferior quadrant of the nasal septum. Okay, then postero-superior quadrant. This is the postero-superior quadrant, right? Antero-superior quadrant and this is the postero-superior quadrant. The postero-superior quadrant, which is the principal artery of the nasal septum, that is sphenopalatine artery. Sphenopalatine artery is nothing but a branch from the maxillary artery, right? So the sphenopalatine artery, which supplies the posterior-superior quadrant. This is the sphenopalatine artery. Of course, it also supplies the posterior-inferior quadrant also. So it is the principal artery of the medial wall of nasal septum and it supplies the posterior-superior quadrant. And coming to the postero-inferior quadrant, it is supplied by the greater palatine artery. The postero-inferior quadrant, it is supplied by the greater palatine artery. It is supplied by the greater palatine artery and also some branches from the sphenopalatine artery. So the medial wall of nasal septum, it is divided into 4 quadrants: antero-superior quadrant, this is antero-superior quadrant, antero-inferior quadrant, posterior-superior quadrant and posterior-inferior quadrant. And the antero-superior quadrant is supplied by the anterior ethmoidal and posterior ethmoidal arteries. And the antero-inferior quadrant, it is supplied by the labial branch of the facial artery. And the posterior-superior quadrant, it is supplied by the sphenopalatine artery, which is the principal artery of the nasal septum, which is derived from the maxillary artery, and the posterior-inferior quadrant is supplied by the some branches from the sphenopalatine artery as well as some branches from the greater palatine artery, which is also a branch from the maxillary artery. And here in the anteroinferior quadrants, all the four arteries, that is anterior ethmoidal artery, sphenopalatine artery, greater palatine artery, and labial branch, they form plexus here at the anterior-inferior quadrant of the nose. And this area is the common site for bleeding of the nose, epistaxis of the nose. And this area we call it as Little's area, which is the common site for the bleeding of the nose. And the plexus here, these arteries, these four arteries, they form plexus here. We call it as Kisselbach's plexus. Kisselbach's plexus. The plexus which is formed by the four arteries, which is formed by the branches of the four arteries, that is anterior ethmoidal artery, labial artery, sphenopalatine artery, and greater palatine artery. This is the greater palatine artery, and they form plexus at the anteroinferior quadrant of the nose. This plexus we call it as Kisselbach's plexus, and this area we call this the Little's area. Usually the epistaxis of the nose, that is bleeding of the nose, occurs this because it is having a rich blood supply. This is a common area of the bleeding of the nose. We call it as the Little's area of the nose. And coming to the venous drainage, the anterior part of the medial wall of the nose, the anterior part of the nasal septum drains into facial vein, and the posterior part of the nasal septum which drains into pterygoid plexus of veins. So the anterior part drains into facial vein, and the posterior part which drains into pterygoid venous plexus. Okay, so that's about the blood supply. And coming to the nerve supply of the medial wall of the nose. So nerve supply of the nasal septum or medial wall of the nose, we can call it as nasal septum. It is supplied by the anterior ethmoidal nerve. So anterior ethmoidal nerve is a branch from the ophthalmic division of the anterior ethmoidal nerve, is a branch from the maxillary division of the trigeminal nerve. So all the sensory nerves, they are supplied by the branches of the trigeminal nerve. Okay, all the sensory nerves, they are supplied by the branches of the trigeminal nerve, and special sensory nerve is carried by the olfactory nucleus, which pierces the cribriform. This is the cribriform plate of the ethmoid. So the special sensory nerves nothing are derived from the olfactory nerves, olfactory nucleus, which pierces the cribriform plate of the ethmoid. They supply the upper part of the nasal septum of the nose, medial nasal septum, medial wall of the nose. So the anterosuperior quadrant is supplied by the anterior ethmoidal nerve, and the anteroinferior quadrant it is supplied by the anterior superior alveolar nerve, which is a continuation of the infraorbital nerve, which is in turn is a branch of maxillary nerve. Okay, so the anterior ethmoidal nerve is a branch of maxillary nerve, and the anterior superior alveolar nerve is a continuation of the infraorbital nerve, which is in turn is a branch from the maxillary nerve. And coming to the posterior superior quadrant is supplied by the medial posterior superior nasal branches from the pterygopalatine ganglion. Here we have nearer to the nasal cavity we have pterygopalatine fossa is present. In the pterygopalatine fossa we have pterygopalatine ganglion. So the medial posterior superior nasal, because these are supplying the medial wall of the nose. That's why they are named as medial posterior superior nasal branches of derived from the pterygopalatine ganglion of pterygopalatine ganglion. They supply the posterior superior quadrant, and the posterior inferior quadrant it is supplied by the nasopalatine branch from the pterygopalatine ganglion. So basically the posterior quadrant it is supplied from the branches from the pterygopalatine ganglion. Okay, so coming to the nerve supply, it is also so that we know that the nasal cavity divides into the medial wall of the nose. The medial wall of the nose divides into, or nasal septum divides into 4 quadrants. The anterosuperior quadrant is supplied by the anterior ethmoidal nerve, which is a branch from the maxillary, and the anteroinferior quadrant is supplied by the anterior superior alveolar nerve, which is a continuation of the infraorbital nerve, which is in turn is a branch from the maxillary nerve, and posterior superior quadrant, it is supplied by the medial, posterior, superior nasal branches from the derived from the pterygopalatine ganglion, and the postero-inferior quadrant, it is supplied by the nasopalatine branch of the pterygopalatine ganglion. So that's about the nerve supply of the medial wall of the nose. Okay. So I'm coming to the lymphatic drainage. The anterior part, the anterior part drains into submandibular lymph nodes, and the posterior part, it is drained into retropharyngeal group of lymph nodes of deep cervical group of lymph nodes. So the posterior quadrant, it is drains into deep cervical or retropharyngeal group of lymph nodes, and the anterior quadrant drains into submandibular group of lymph nodes. So that's about the medial wall of the nose or nasal cavity. So the nasal cavity or medial wall of the nose divides the nasal cavity into two halves. So this is the nasal septum. This is the nasal septum or medial wall of the nose divides the nasal cavity into right and left halves. This nasal septum, it is not strictly median. It is divided to one or the other side. Okay. And coming to this one, the bony part of the nasal septum. So the nasal septum, it is consists of bony part, cartilaginous part and cuticular part. The bony part, it is formed by omer and perpendicular plate of ethmoid, which is also receives contribution to the nasal crest of the nasal and maxillary bones. And also the bony part is formed by two bones, perpendicular plate of ethmoid and omer. The cartilaginous part, it is supplied by the septal cartilage and the septal process of the inferior nasal cartilage, and the cuticular part is covered by hydrofatty tissue covered by skin. The lower margin of the nasal septum, we call it as columella. Okay. So and coming to the blood supply, the medial wall of the nose or nasal septum divides into the four quadrants: anterior superior, anterior inferior, posterior superior, posterior inferior. Anterior superior quadrant is supplied with the anterior and posterior ethmoid arteries. Anterior inferior quadrant is derived from the labial branch of the is supplied by the labial branch of the facial artery. Posterior superior quadrant, it is supplied by the sphenopalatine artery, which is a branch from the maxillary artery, which is the principal artery of the nasal septum. And the posterior inferior quadrant is derived from, it is supplied by the branches from the sphenopalatine artery, also branches from the greater palatine artery, which is in turn is a branch of maxillary artery. And at the anteroinferior quadrant, all these arteries, they form plexus. We call it as Kisselbach's plexus, and we call this area causes the bleeding of the nose, common site for the bleeding of the nose, epistaxis of the nose, and this area we call it as Little's area. And the venous drainage into anterior part into facial vein, and the posterior part into pterygoid venous plexus, posterior part into pterygoid venous plexus, anterior part into facial vein. And coming to the nerve supply, anterosuperior quadrant is supplied by the anterior ethmoidal nerve, which is nothing but a branches. General sensory, it is derived from the anterior ethmoidal nerve, and posterior anterosuperior anteroinferior quadrant is supplied by the anterosuperior alveolar nerve, which is in turn is a branch of continuation of maxillary nerve, infraorbital nerve, which is in turn is a branch of maxillary nerve. So anterosuperior alveolar nerve is a continuation of the infraorbital nerve, which is in turn is a branch of the maxillary nerve. And the posterior superior quadrant, it is supplied by the medial posterior superior nasal branches from the pterygopalatine ganglion, and the posterior inferior quadrant, it is supplied by the nasopalatine branch from the pterygopalatine ganglion. And the lymphatics, the anterior part of the lymphatics, they drain into submandibular lymph nodes, and the posterior part of the lymphatics, they are drained into deep cervical group of lymph nodes as well as the retropharyngeal group of lymph nodes. So that's about the medial wall of the nose or nasal septum. So coming to the lateral wall of the nose. So the lateral wall of the nose, consists of the lateral wall of the nose situated here. This is the lateral wall of the nose, and the lateral wall of the nose consists of bony projections called concave. So the lateral wall of the nose consists of bony projections called concave. These bony projections, they increase the surface area and they help in conditioning of the air, which we have inspired. They help in air conditioning. So they increase the surface area for air conditioning. So the lateral wall of the nose is irregular and consists of bony projections. We call them as concave. So these concave, they increase the surface area. This is the lateral wall of the nose. Okay, this is the lateral wall of the nose. So this is the lateral wall of the nose. Okay, this is the medial wall and this is the lateral wall of the nose. Okay, they are irregular. It is irregular because of the bony projections called concave. Okay, these concave increase the surface area for absorption for air conditioning of the inspired air, for air conditioning of the inspired air. Okay, so coming to the lateral wall of the nose, the lateral wall of the nose separates the nose from the orbit above, separates the nose from the orbit above, maxillary sinus below, and nasal lacrimal duct and lacrimal sac in front. So the lateral wall of the nose separates the nose from the orbit above, maxillary sinus below, and the nasolacrimal duct and lacrimal sac in front. So the coming to the lateral wall of the nose, the lateral wall of the nose consists of three parts. This is the part we call it as vestibule of the vestibule, and then cartilaginous part, and then bony part. The vestibule of the, this is called the vestibule of the nose. This is the vestibule, and it is nothing but consists of fibrofatty tissue and consists of some stiff hair is present, stiff coarse hair is present in the vestibule. And coming to the cartilaginous part, the lateral wall of the nose, it consists of three parts: bony part, cartilaginous part, and cuticular part. Like the medial wall of the septum, the bony part, it is formed by overall 7 bones. It is formed by nasal bone. This is the nasal bone, and this is the frontal process of maxilla, nasal bone, frontal process of maxilla, and also lacrimal bone. This is the lacrimal bone, and this is the ethmoid bone, and this is the ethmoid bone, and this is the middle concha, and this is the inferior concha, this is the inferior concha, and this is the perpendicular plate of palatine bone, and this is the medial pterygoid plate. So the bony part of the lateral wall of the nose, it is formed by the nasal bone. So we know that this is the nasal bone, right? This is the nasal bone, and here we have the frontal process of the maxilla. This is the frontal process of the maxilla, right? This is the frontal process of the maxilla, nasal bone, and lacrimal bone here, lacrimal bone, and this is the ethmoid bone, middle concha. This is the middle concha here. This is the middle concha. Okay, this is the middle concha and the inferior concha. Middle concha and superior concha. We have three conchae: superior, middle, and inferior conchae. So these conchae, they project downwards and medially from the lateral wall of the nose. So these conchae, they project downward and medially from the lateral wall of the nose. So the superior concha and middle concha, they are nothing but the parts of labyrinth of the ethmoid. They are derived from the labyrinth of the ethmoid. Superior concha and middle concha. Here we can see the middle concha here, right? So the middle concha and superior concha is above the middle concha. Superior concha and middle concha, they are the parts of labyrinth of the ethmoid, and the inferior concha, it is an independent bone. This is the inferior concha. Okay, the inferior nasal concha is nothing but an independent bone. So the lateral bone of the nose is found by the superior and middle concha, which is the parts of labyrinth of the ethmoid, and the inferior concha, it is an independent bone, and it is also found by the perpendicular plate of palatine bone. We know that perpendicular plate of palatine bone is here. This is the perpendicular plate of palatine bone. Perpendicular plate of palatine bone. This is the perpendicular plate of palatine bone. They also form the lateral wall of the nose, perpendicular plate of the palatine bone, perpendicular plate, and also it is also formed by the medial pterygoid plate. It is also formed by the medial pterygoid plate. You can see the perpendicular plate here. This is the perpendicular plate of palatine bone. Okay. So the bony part, it is formed by the nasal bone, frontal process of maxilla, and also it is formed by the lacrimal bone, ethmoid bone, and it is formed by the perpendicular plate of palatine bone, and also it is formed by the medial pterygoid plate, and it is formed by the superior, middle, and inferior concha. Superior concha, middle concha are the parts of the bony labyrinth of the ethmoid, and the inferior concha, it is an independent bone. Okay, so the bony part of the lateral wall of the nose, it is formed by these 8 bones. And coming to the cartilaginous part, the cartilaginous part, it is formed by the superior nasal cartilage and inferior nasal cartilage, and 3 to 4 alar cartilages. They form the cartilaginous part of the lateral wall of the nose. So the bony part is formed by these bones, and coming to the cuticular part, it is nothing, it is covered by skin, which consists of fibrofatty tissue. Okay, and the lower part of the lateral wall of the nose, we called it as vestibule of the nose. So this is the vestibule lower part of the lateral wall of the nose, we call it as vestibule of the nose. So the lateral wall of the nose, it is consists of bony part, cartilaginous part and cuticular part. So the lateral wall of the nose consists of bony part, cartilaginous part and bony part, cartilaginous part, cuticular part. So the bony part, it is found by the nasal bone, contact process of maxilla, lacrimal bone, ethmoid bone, and also the superior, middle concha, superior concha, middle concha and inferior concha. Superior concha and middle concha, they are nothing but the parts of bone, labyrinth of the ethmoid, and it is formed by the perpendicular plate of palatine bone, and also it is formed by the medial craneoid plate. These bones, they form the bony part of the lateral wall of the nose. And coming to the cartilaginous part, it is found by the superior nasal cartilage, inferior nasal cartilage and also 3 to 4 alar cartilages. Okay, and coming to the cuticular part is covered by skin, consists of fibropatic tissues. So these structures form the lateral wall of the nose. So similar to the medial wall, it also consists of bony part, cartilaginous part and cuticular part. Okay, so the passages below the conchae, we call it as meatus. We know that 3 conchae, they project from the lateral wall of the nose. 3 conchae, they project from the lateral wall of the nose downwards and medially. They increase the surface area for air conditioning. Surface area of absorption for air conditioning. They increase the surface area for air conditioning of the inspired air. These conchae, they project like this from the lateral wall of the nose. Superior concha, middle concha and inferior concha. Superior concha is comparatively smaller compared to middle and inferior concha. Inferior concha, it is a very large bone, it is an independent bone. Superior concha and middle concha, they are the parts of the labyrinth of the ethmoid. And beneath the concha, we have passages, we call them as meatuses. Meatuses are the passages present beneath the concha. So this is the superior concha, this is the superior concha, superior concha, this is the middle concha and this is the inferior concha. So this is the superior meatus of the nose. The passages beneath the superior concha, we call it as superior meatus, and this is the inferior meatus, and this is the middle meatus, and this is the inferior meatus. The passages beneath the concha, we call them as meatuses. So this is the superior meatus, middle meatus, and this is the inferior meatus. Okay, so into these meatuses, the paranasal 8 sinuses open. So the paranasal sinuses, they are 4 in number: frontal 8 sinus, sphenoidal 8 sinus. The paranasal 8 sinuses are 4 in number. They are nothing: frontal 8 sinus, sphenoidal 8 sinus, maxillary 8 sinus, and ethmoidal 8 sinuses. Okay, so the paranasal sinuses, they open into these meatuses of the nose. So the meatuses are nothing but the passages beneath the conchae. We have 3 conchae: superior, middle and inferior. Inferior concha is the largest concha and it is an independent bone. Superior and middle concha, they are the parts of the labyrinth of the ethmoid. Superior concha, it is very small. Okay, so coming to the sinuses, what are the sinuses opening into the meatus of the nose? So through the inferior meatus of the nose, nasolacrimal duct opens into the inferior meatus of the nose at the junction of anterior 1/3 and posterior 2/3. At the junction of anterior 1/3 and posterior 2/3, the nasolacrimal duct opens into the inferior meatus of the nose. Okay, and coming to the middle meatus, beneath the middle meatus of the nose, we have a bony projection. We have a bony bulging caused by the middle ethmoidal 8 sinuses. Ethmoidal 8 sinuses are 3: anterior, middle and posterior. Okay, so beneath the middle meatus, we have a bulging here. Beneath the middle meatus, we have a bulging here, bony bulging caused by the underneath the middle ethmoidal 8 sinuses. This bony bulging, we call it as bulla ethmoidalis. So this is the bony bulging present beneath the middle meatus of the nose. We call this bulging, we call it as bulla ethmoidalis. So the bulla ethmoidalis is produced because of the underlying middle ethmoidal air sinuses. So the middle ethmoidal air sinuses, they open into the bulla ethmoidalis. So the opening of the middle ethmoidal air sinuses is present beneath the middle meatus with a bulging. The bulging, bony bulging, we call it as bulla ethmoidalis. Into the bulla ethmoidalis, the middle ethmoidal air sinuses open. Okay, and coming to the just below the bulla ethmoidalis, we have a hiatus. We call it as hiatus semilunaris. We call it as hiatus semilunaris, which is present beneath the bulla ethmoidalis. This is the hiatus semilunaris. Okay, so this is the hiatus semilunaris, which is present, hiatus semilunaris. Okay, hiatus semilunaris, which is present beneath the swelling, a sulcus, we call it as hiatus semilunaris, which is present beneath the bulla ethmoidalis. Bulla ethmoidalis is a bony bulging caused by the underneath the middle ethmoidal irises, and hiatus semilunaris, it is a sulcus present beneath the bulla ethmoidalis. From the hiatus semilunaris, a passage extends, we call it as infundibulum. From the hiatus semilunaris, a passage occurs, we call it as infundibulum, and through the infundibulum, frontal air sinuses open into the anterior part of hiatus semilunaris. Frontal air sinuses open into the anterior part of hiatus semilunaris. Just behind the frontal air sinuses, we have the opening of anterior ethmoidal air sinuses. So the anterior ethmoidal air sinuses and frontal air sinuses, they open into the anterior part of hiatus semilunaris. This is the hiatus semilunaris. Okay. And the maxillary air sinus, it opens into the posterior part of hiatus. This is the opening of the maxillary air sinus. Maxillary air sinus, which opens into the posterior part of hiatus semilunaris. Okay, so to the anterior part of hiatus semilunaris, to the frontonasal duct, they open the frontal and anterior ethmoidal air sinuses. They open into the anterior part of hiatus semilunaris through frontonasal duct, and through the posterior part of hiatus semilunaris, maxillary air sinus open. And just above and behind the middle concha, we have superior concha is this. Superior concha, it is a small bone. Beneath the superior concha, we have passage that is called superior meatus. Into the superior meatus, we have the opening of posterior ethmoidal air sinus. We have already told you the ethmoidal sinuses are 3 in number. They are anterior, posterior and middle. So the anterior ethmoidal air sinus, it opens into the middle meatus of the nose at the anterior end of hiatus semilunaris, just behind the frontal air sinus. Okay, and the middle ethmoidal air sinuses, they open. The middle ethmoidal air sinuses, they open into the bulla ethmoidalis, and the posterior ethmoidal air sinuses, they open into the superior meatus of the nose. And above the superior concha, we have a recess here. This is called sphenoethmoidal recess, through which sphenoidal air sinus open. Okay, so those are the openings of the paranasal air sinuses into the lateral wall of the nose. So the lateral wall of the nose, there are some passages present at the lateral wall of the nose beneath the concha. We call them as meatuses. They are superior, middle and inferior meatuses. Inferior meatus, into the inferior meatus, what opens? Opening of the nasolacrimal duct. Into the middle meatus, all frontal air sinus opens, and frontal air sinus opens at the anterior end of hiatus semilunaris, and also anterior ethmoidal air sinus opens at the anterior end of a hiatus semilunaris. Maxillary sinus opens into the posterior end of hiatus semilunaris, and into the bony bulging which is found by the middle ethmoidal air sinuses, where the middle ethmoidal air sinus opens, and into the superior meatuses. Superior meatus, what opens? Posterior ethmoidal air sinus open. Just above and behind the superior meatus, we have a sphenoethmoidal recess is present, which resists the opening of the sphenoidal air sinus. So that's about the lateral wall of the nose. Those are the openings of the paranasal air sinuses into the lateral wall of the nose. Just in front of the middle concha, just in front of the middle concha, we have a mucus depression, we call it as atrium. Just in front of the middle concha, we have a mucus depression, that one we call it as atrium. Atrium. Okay, this is the which is bounded above by a mucus fold called agar nasal, which is bounded by a mucus fold by a agar nasal, and this opening of the frontonasal duct, it is guarded by a valve. This opening of the frontonasal duct into the inferior meatus of the nose, it is guarded by a valve. That valve we call it as Hasner's valve. That's where the opening of the frontonasal duct into the inferior meatus of the nose is guarded by a valve. We call it as Hasner's valve. And this is the vestibule of the nose. The lower part we call it as the vestibule of the nose, and this is the atrium. The middle part we call it as atrium, and this is the remaining part which consists of meatus, where the opening of the paranasal air sinuses opens into the meatus of the nose, which are nothing but the passages beneath the conchae, superior, middle and inferior conchae. Okay, so that's about the opening of the paranasal air sinuses into the lateral wall of the nose. Okay, and coming to the blood supply. Blood supply of the lateral wall of the nose, similarly to the medial wall of the nose, similar to the nasal septum, it is also divided into 4 quadrants. Antero-superior quadrant, antero-inferior quadrant, posterior-superior quadrant and posterior-inferior quadrant. Similar to the antero-superior quadrant, it is supplied by the anterior and posterior ethmoidal artery, which is also supplies the same arteries also supplies the antero-superior quadrant to the nasal septum. So the antero-superior quadrant is supplied by the anterior and posterior ethmoidal arteries, and the antero-inferior quadrant, it is supplied by the branches of the facial artery. And the posterior-superior quadrant, it is supplied by the sphenopalatine artery. We know that which is a branch of maxillary artery, and greater palatine artery. The antero-inferior quadrant is supplied by the greater palatine artery. Branches of the greater palatine artery. The greater palatine artery, it pierces the palate at the incisive fossa, perpendicular plate of ethmoid at the at the palatine bone at the incisive fossa, and it also supplies the antero-inferior quadrant. So greater palatine artery, so the antero-superior quadrant will be supplied by the anterior and posterior ethmoidal artery, and antero-inferior quadrant, it is supplied by the labial branches of the facial artery, and the posterior-superior quadrant is supplied by the sphenopalatine artery, and posterior-inferior quadrant is supplied by the branches of the greater palatine artery. Okay, and it also supplies the branches of the greater palatine artery. Through the incisive fossa, it also supplies the antero-inferior quadrant. So that's about the blood supply. And coming to the venous drainage, anterior part of the veins drain into facial vein, and the posterior part of the veins, they drain into pharyngeal group of venous plexus, and the middle part they drain into pterygoid venous plexus. So anterior part they drain into facial vein, and the posterior part drain into pharyngeal plexus of veins, and the middle part drains into pterygoid venous plexus. Okay, so that's about the blood supply. So coming to the nerve supply of the lateral wall of the nose. So the lateral wall of the nose, it is similar to the nasal septum. It is also divided into 4 quadrants: antero-superior quadrant, antero-inferior quadrant, posterior-superior quadrant, and posterior-inferior quadrant. Here I have presented the nerves with green color instead of yellow color. I have represented the nerve with a green color. So the antero-superior quadrant is supplied by the anterior ethmoidal nerve, which is a branch of the ophthalmic division of the trigeminal nerve, and the antero-inferior quadrant is supplied by the anterior superior alveolar nerve, which is a branch from the infraorbital nerve, which is nothing but the continuation of the maxillary nerve, and posterior superior quadrant, it is supplied by the lateral posterior superior branches of the pterygopalatine ganglion. So, and posterior inferior part, it is supplied by the branches of the anterior palatine nerve, which is from the pterygopalatine ganglion. So the lateral wall of the nose, the general sensory nerves, they are supplied by the branches of the trigeminal nerve. So the anterior ethmoidal nerve is a branch of the ophthalmic, and the anterior superior alveolar nerve is a branch of this continuation of the maxillary nerve, branch of infraorbital, and the posterior superior quadrant is derived from the lateral posterior superior nasal branches of the pterygopalatine ganglion, and the posterior inferior quadrant is supplied by the branch. This is the anterior palatine nerve branches from the anterior palatine nerve derived from the pterygopalatine ganglion. And coming to the blood supply is over, nerve supply is over, and coming to the lymphatic drainage, the anterior part drains into submandibular lymph nodes. The anterior part of the lateral wall of the nose drains into submandibular lymph nodes, and the posterior part drains into retromandibular group of lymph nodes, retropharyngeal group of lymph nodes, and also into the deep cervical group of lymph nodes. And one more thing is the special sensory nerves, they are derived from the olfactory. They are special sensory nerves. They are derived from the olfactory rootlets, which supplies the upper part. Special sensory nerves by the olfactory rootlets, which pierce the cribriform plate of the ethmoid, So that's about the nerve supply. Special sensory by the branches of the trigeminal, general sensory by the branches of the trigeminal, and special sensory by the olfactory rootlets. And the lymphatic drainage, the anterior part into submandibular lymph nodes, and the posterior part into retropharyngeal group of lymph nodes and deep cervical group of lymph nodes. So that's about the lateral wall of the nose. So the lateral wall of the nose, it consists of bony projections called concave, superior, middle, and inferior concave. The superior concave, beneath the superior concave, we have the passages, we call them as superior meatus, middle meatus, and inferior meatus. Superior concha and the inferior concha, they are the branches of the labyrinth of the ethmoid, and the inferior concha they are the parts of the labyrinth of the ethmoid, and the inferior concha is an independent bone. The lateral wall of the nose consists of cuticular part and cartilaginous part as well as the bony part. The cuticular part, it is formed by the skin, fibrofatty tissue, and the cartilaginous part is formed by the superior and inferior nasal cartilages and alar cartilages, and the bony part is formed by the lacrimal bone, frontal process of maxilla, nasal bone, frontal process of maxilla, lacrimal bone, and the ethmoid bone here, and also superior and middle concha, which are the parts of the bony labyrinth of the ethmoid. And the inferior concha, it is also formed by palatine process of maxilla, perpendicular plate of palatine bone. This is the perpendicular plate of palatine bone, and also medial pterygoid plate. So these are the bones. They form the bony part of the lateral wall of the nose, and beneath the concave we have meatus, which receives the openings of the paranasal air sinuses, and this is the nerve supply, and this is the nerve supply, which is sensory nerves are by the special sensory nerves by the olfactory nerves, olfactory lobulus, and general sensory by the branches of the trigeminal nerve. So that is the end of the lateral wall of the nose.